Hello everyone, I am Dr. Ziyad, MBBS, MD in Health Informatics. I am also specialized in clinical terminology and medical coding. In this tutorial series, I will walk through Model Paper 1 for the AAPC CPC examination. I'll share quick techniques to find answers very easily, along with the detailed explanation to help you to understand the key concepts. Certified Professional Coder, that is CPC exam, evaluates the proficiency in medical coding through 100 multiple choice questions covering 17 key knowledge areas. Model Paper 1, second video. In this video, we will see the anatomy questions. There are 4 anatomy questions. These questions will assess your knowledge of anatomy and all body systems of the human body. Model Paper 1, Chapter 2, Anatomy, 4 questions. So the first question is, the lunula is a part of which of the following structures? A. Skin, B. Nail, C. Thyroid, D. Ear. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Yeah, if you know the anatomy, this question will be very easy for you. So the lunula is the part of the nail. You can see the number 4 here. This part is the lunula. So this is the half moon shaped area at the base of the nail. The lunula, this is number 4. Is a region where new growth occurs. The lunula has a whitish appearance because vascular tissue underneath does not show through. So you can see this is the lunula. Same thing you can see in the side view. This part is the lunula where the nail growth occurs. So the answer is B. Question number 2. A patient presents with an injury to the great saphenous vein. Which anatomical region is likely affected? A. Neck, B. Arm, C. Leg, D. Abdomen. So pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Yeah, if you know the anatomy of the venous system, this question will be easy for you. So if you take the heart, the venous systems are draining in the blood into the heart. So if you see, the main draining vessels are vena cavas, that is superior vena cava on the top and the inferior vena cava from the bottom. So if you take the inferior vena cava, go down, you can see it's divided into 2 main veins, that is common iliac vein. So in the hip region, this vein is divided into 2 veins, the right side and left side, common iliac veins. In the common iliac vein, in the thigh region, divided into the main femoral vein and the great saphenous vein. You can see femoral vein, this one is femoral vein and this one is the great saphenous vein. Again, the femoral vein in the knee region divided into 2. You can see one is the small saphenous vein, other one is tibial vein. Again, the tibial vein divided into anterior and posterior like this, it's go down. So the great saphenous vein or the saphenous vein is belong to the leg. So in this question, the answer is C. Let's go to the third question. An umbilical hernia protrudes from which of the following body areas? A. The inguinal space in the groin area. B. The esophageal space in the abdomen. C. The belly button. D. The testis. So please pause the video for a few seconds and think the answer.
5, 4, 3, 2, 1.
Okay, if you know the umbilical hernia is in the umbilical region, so you can exclude this B, that is esophagus, so it's not correct answer. And the 3 other answers are inguinal space, belly button, the testis. So you can remove this testis as well. So A and C are the probable answer. So let's see how the hernias occur in our body. You can see there are 5 main hernias there. So the hernia means it's a protrusion of any organ, tissue or structure through the wall of the cavity in which it is naturally contained. For example, inguinal hernia, that is occur in the inguinal or groin region, develops in the groin where the abdominal folds of flesh meet the thighs. Strangulated hernia, that is not the separate hernia. Once the inguinal hernia or other hernia develop into the necrosis or gangrene, it is called the strangulated hernia. When the hernia becomes tight, the tissue part will be damaged or necrosed. That is called the strangulated hernia. The umbilical hernia, you can see number 3 here. The umbilical hernia is a protrusion of the part of the intestine at the navel or belly button. Other hernias are diaphragmatic hernia and hiatal hernia, where this diaphragmatic hernia normally occur as a congenital disorder, and the hiatal hernia in which the lower part of the esophagus and the top of the stomach slide through an opening, that is called hiatus, in the diaphragm into the thorax. So for this question, you don't need much knowledge because straight away you can answer the umbilical hernia is C, the belly button. But this additional knowledge on hernia is very important to face the main questions. So in this question, the correct answer is C, that is the umbilical hernia protrudes through the belly button. Question number 4. Which of the following has a refraction function in the eye? A. Macula, B. Retina, C. Lens, D. Iris. So please pause the video for a few seconds and think the answer.
3, 2, 1.
So if your mother tongue is not English, you may be confused what is meant by refraction. So I'll show you here. The refraction is when the rays of light come into your eye parts converge the light rays to the retina to display the image. So this convergence, this path change occur due to some structures in the eye. So the refractive media of the eye are transparent structures that allow light to pass through and focus on the retina. So the cornea is the main part that make refraction, make the 70% of refraction. The second one is the lens, other 20 to 30% refraction done by the lens, and the aqueous humor, the fluid in the front chamber, and the vitreous humor, that is fluid in the back side, or that this fluid maintain the globe of the eye. These two also helps the refractory function. So main refractory parts are cornea, that belongs to 70%, and the lens is belong to 20 to 30%. So in this question, the answer is C, that is lens. So if you are preparing for the AAPC CPC examination, my channel will help you to solve the problems you are facing in your examination preparation. So please subscribe my channel. And if you have any doubts or any questions, you can put in the comment section, or else you can email me, or you can WhatsApp me to the email and the WhatsApp number displayed here. So please subscribe my channel and stay with me. Thank you.